Hello friends, welcome to Tutelage, the career guru for nurses. In this video, we are discussing some of the important questions from endocrine system. First question, which of the following is indicative of diabetes insipidus? Option A, increased glucose level. Option B, decreased serum osmolarity. Option C, increased blood pressure. Option D, low urine specific gravity. The correct answer is option D, low urine specific gravity. The answer of this question can be easily found out by elimination method. I will tell you how we are doing this. First, we have to understand what is diabetes insipidus. Diabetes insipidus is a condition in which there is excessive urine production. So, urine output will be more and urine will be very dilute. And it results in low specific gravity of urine since it is very dilute. There is deficiency of ADH. ADH is antidiuretic hormone. So when we see the first option, that is increased glucose level, we can understand that diabetes insipidus is not a disorder of glucose metabolism. So we can eliminate that option. Considering the second option B, decreased serum osmolarity, then as fluid is lost from the vascular compartment, serum osmolarity increases. So the option B also can be eliminated. Then increased BP. Here loss of fluid happened and actually it lowers the blood pressure. So option C also can be eliminated. The correct answer we can find out as D, low urine specific gravity. So by elimination method, we have to carefully examine each option and eliminate wrong answers one by one. Second question, a patient with head injury has large amounts of clear colorless urine. What may be the cause? Option A, decreased renal perfusion. Option B, increased blood sugar. Option C, inadequate ADH secretion. Option D, excessive IV fluid administration. Here the answer is option C, inadequate ADH secretion. ADH means antidiuretic hormone. Deficient ADH from the posterior pituitary is known as condition called diabetes insipidus. It can be caused by head trauma. Water is not conserved by the body and excess amount of urine are produced. Considering option A, decreased renal perfusion. Due to decreased renal perfusion, urine production also decreased. So we can eliminate option A. Considering option B, increased blood sugar. We can eliminate that option also because increased blood sugar can cause polyuria, but it is associated with diabetes mellitus, not diabetes insipidus. Considering option D, excessive IV fluid administration. While this could cause dilute urine, it is unlikely that a client with head injury would receive excessive fluid because the danger of increased intracranial pressure is there. So for a client with a head injury, we won't usually administer excessive fluid in a clinical setting. Third question is, antidiuretic hormone ADH influences kidney function by stimulating option A, nephron tubules to reabsorb water. Option B, nephron tubules to reabsorb glucose. Option C, glomerulus to withhold proteins. Option D, glomerulus to regulate the quantity of fluid passing through it. Correct answer is option A. That is, nephron tubules to reabsorb water. Antidiuretic hormone causes the nephrons to reabsorb water. That is a fact. Option B can be eliminated because reabsorption of glucose is not affected. Option C and D can be eliminated because the glomeruli are not affected by antidiuretic hormone. And we can reach to the answer, that is option A, nephron tubules to reabsorb water. Fourth question is, how long do hormones remain in the body once secreted from endocrine glands? Options are A, 24 hours, B, 4 to 6 hours, C, 8 to 12 hours, D, more than 72 hours. The correct answer is option B, 4 to 6 hours. Hormones are inactivated by the liver and other tissues fairly rapidly. Continuous hormonal secretion by the endocrine glands is regulated by immediate feedback controls. Fifth question. What is the effect of ADH in human body? Option A, increased serum osmolarity. Option B, decreased urine concentration. Option C, decreased glomerular filtration rate. Option D, increased tubular reabsorption of water. The correct answer is option D, increased tubular reabsorption of water. Action of ADH is reabsorption of sodium and water in kidney tubules, which decreases urinary output and retain body fluids. Option A is increased serum osmolarity. But ADH causes water reabsorption, so osmolarity reduces. Option B is decreased urine concentration, but urine concentration is increased because water is reabsorbed, so urine becomes concentrated. So both A and B options can be eliminated. Option C is decreased glomerular filtration rate. It can be eliminated because there is no effect on filtration with ADH. ADH increases reabsorption in the tubules. ADH doesn't affect the glomerular filtration rate. It only increases the reabsorption of water and sodium from the tubules. Sixth question. In a patient with syndrome of inappropriate secretion of antidiuretic hormone SIADH, which of the following is expected? Option A, polyuria. Option B, hypotension. Option C, hyponatremia. Option D, decreased specific gravity of urine. SIADH is a condition in which there is increased production of antidiuretic hormone. Keeping this point in mind, consider option A, polyuria. We can eliminate this option because oliguria happens here because of increased production of ADH, antidiuretic hormone. Sodium and water is reabsorbed and it happens in reduced urine output, oliguria. So that option we can eliminate. Option B, it can be eliminated because water reabsorption causes blood volume to increase and causing hypertension and not hypotension. Option C, that is a correct answer. Retention of water causes dilutional hyponatremia. So that is the correct answer. D can be eliminated because due to oliguria, urine specific gravity increases as a result of increased urine concentration. So A, B and D options can be eliminated and the correct answer is hyponatremia. That is dilutional hyponatremia. Seventh question. For a patient who is scheduled for bilateral adrenalectomy, which medication the physician would order? Option A, ACTH. Option B, regular insulin. Option C, pituitary extract, pituitrin. Option D, hydrocortisone. Correct answer is option D, that is hydrocortisone. Hydrocortisone succinate is a glucocorticoid. A client undergoing bilateral adrenalectomy must be given adrenocortical hormones because it can prevent adverse effect due to sudden lack of these hormones that occur with the surgery. We can eliminate option A, that is ACTH, because adrenal glands are removed, ACTH will not have a target gland to act upon. So there is no point in giving ACTH. Option B can be eliminated because insulin is produced by pancreas and its function is not altered by this adrenal surgery. Option C can be eliminated because option C, the surgery involves adrenals and so secretion of pituitary hormones will not be affected. So correct answer is option D, hydrocortisone to be administered in a patient who is scheduled for adrenalectomy. After adrenalectomy, the nurse must monitor the patient for option A, hypotension, option B, hyperglycemia, option C, sodium retention, option D, potassium excretion. The correct answer is option A, hypotension. After adrenalectomy, adrenal insufficiency causes hypotension because of fluid and electrolyte alterations. Option B can be eliminated because hypoglycemia may be a problem due to the loss of glucocorticoids. Option C also can be eliminated because hyponatremia occur due to the lack of mineralocorticoids. So sodium retention doesn't happen. Option D can be eliminated because potassium ions may be retained due to the lack of mineralocorticoids. Mineralocorticoids causes the retention of sodium and excretion of potassium. Due to the lack of this electrolyte imbalance happens. Ninth question. The most common cause of Cushing's syndrome is option A, pituitary hypoplasia, option B, insufficient ACTH production, option C, hyperplasia of the adrenal cortex, option D, deprivation of adrenocortical hormones. The correct answer is option C, that is hyperplasia of the adrenal cortex. Hyperplasia of the adrenal cortex leads to increased secretion of cortical hormones, which causes Cushing syndrome. Option A can be eliminated because the pituitary hypoplasia result in Simmons disease, that is panhypopituitarism, which has symptoms similar to those of Addison's disease. Eliminate option B because ACTH stimulates production of adrenal hormones. Inadequate ACTH would result in Addisonian symptoms, not Cushing syndromes. Option D can be eliminated because Cushing syndrome results in excessive cortical hormones. Here we should have the understanding that Cushing syndrome is due to the excessive cortical hormones. So option C, hyperplasia of the adrenal cortex causes excessive cortical hormones and it results in Cushing's syndrome. 10th question. Which is a clinical indicator of Cushing syndrome? Menorrhagia, option B, buffalo hump, option C, dependent edema, option D, migraine headache. The correct answer is option B, buffalo hump. Cushing syndrome results from excessive adrenocortical activity. Hypercortisolism causes fat redistribution resulting in buffalo hump. It is also contributing to the slow wound healing, hirsutism, weight gain, hypertension, acne, moon face, thin arms and legs, and behavioral changes. These are the important features of Cushing syndrome. Here we can eliminate option A because menorrhagia, excessive menstrual bleeding, does not occur in Cushing syndrome. Menstruation may cease or may be scanty because of virilization. Option C can be eliminated because edema does not occur except when heart failure is present and is severe. We can eliminate option C because headaches are not caused by Cushing syndrome. Thank you. Happy learning with Tutelage.